There's a lot of information here. It gets overwhelming. It gets overwhelming. I don't know about you. I pull away eventually. That's why I do my best to provide you ways to use the first aid, because the first aid is a great book. It's just, it's intimidating because a lot of information. That's all. So I do my best to show you what I got. Hopefully it works. Hopefully you can apply it and push forward with this. Yes, yes. Makes sense. Honestly, it really does. Okay. I'll actually do something different here. I'm going to show you something right now quickly. Give me a second. Show you how easy this is. If you have problems with hepatitis B, for example, you said, Stavro, man, I just don't get it. I want to do more questions. You can clearly open up and do more scenarios within the actual section. So that's why when I teach my students and I push you guys to pass, it's because if you find topics you have difficulty with, AMBOSS sets it up for you. You just click, 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 and do questions here. If you go see patients in the hospital and you keep misdiagnosing something in the cardiology, how do you get better? You go see patients within that particular topic or disease. That's why fellowships are 2 years, at least 2 years, because you do 2 years of that specialty to learn everything about that particular specialty. See this beautiful photo here? You see the color coordination? Do you see red anywhere in the window period? I do not. Red is surface antigen in this picture and anti-surface antibody. So this is empty. This is only in the window period. You only see E, which is this. You see blue and blue, which is these guys. You don't see the red at all. Okay. So that's why I do this purposely, to show you guys that if you have any issues, you can easily get the information provided to you specifically because it's important. Okay. I will show you something quickly here. If I have issues with hepatitis B and I'm not getting it right, I just really confused. All the information is here in front of you in AMBOSS. You can go click, click, click. And what I suggest you guys to do is get to the QBank here, click it, and say, okay, I will do now. This is an example, so I can show you guys what I mean. 13 questions on hepatitis B. 13 questions. You're telling me if you spend an hour, 2 hours doing all these questions, you won't come out knowing more about hepatitis B? Of course you will. There's no way you won't, right? But don't do it in 10, 15 minutes. Take your time. Why I'm showing you this is when you come to me and say, Dr. Stavros, I don't get anti-diabetics. I don't get cardiogenic shock. I don't understand about restrictive versus, obstructive lung disease. Well, what is my answer? Go to AMBOSS, focus on those particular scenarios, and absorb the content. Look at the scenarios, learn from the scenarios. Yes, if you do that, my friend, you're going to do very well. I will show you something beautifully now. Watch this. You know it's hepatitis B, right? I'm going to show you something. It's going to blow you away, maybe, maybe not, hopefully not. Okay, so we just did something earlier about hepatitis B. Okay, cool. This looks a little tricky, but it's familiar. I mean, we have this. This is actually in first aid as well. So we have surface antigen, which is what? Surface antigen is infection. Anti-surface antibody means what? The person was infected, now they're recovered or vaccinated. Okay. G versus M, we know the difference, right? G is chronic, M is acute. Okay. Watch this scenario. This is how tricky USMLE is. And because of that, we have to work harder to make sure we don't get stuck. Yes, yes. Watch this scenario. Ready? I'm going to show you the scenario. I'm going to read it and you follow along. Just changing my page here. Okay, watch this. So we have the course of different serum parameters over the 4 months is shown. Which of the following is the most likely explanation for the course of this patient's lab findings? Okay, so typically, like I said before, we always read the last 2-3 lines. Most likely, you'll get some information out of it. Typically, go to the top if you need to learn more of the scenario. So I'm going to go to the top and see what it's asking of us, right? A 37-year-old man comes to the physician because of a 3-day history of fatigue, yellow discoloration of his eyes and skin. Physical exam shows mild right upper quadrant abdominal tenderness. The course of different serum parameters over the following 4 months is shown. Which of the following is most likely explanation of the lab findings? Why did I read it twice? Because it's been shown through my statistics, because I've worked with thousands of students, that many students either misread the last line or maybe they read it, but they didn't understand it. So if I ask you to read the last 3 lines, go to the top and read the whole thing. By default, you read the last 3 lines twice. It minimizes your error of making a mistake. Yes? Yes. Okay. What is the question asking us? Look at the lab values here. It's actually just lab here, right? Check this out. 4 months. May I ask you guys all a question? It says in the following 4 months. So if I take a slice right here, I take a slice. At this point in time right here, is this person infected or not? Is this an actual active infection? I need you guys to put the chat below. Tell me, is this person infected, yes or no? Do they have an infection currently at 4 months? Because they ask for the next 4 months, right? This is what the question asks. They go, the course of different serum parameters over the following 4 months is shown. Which of the following is most likely explanation? Okay, so look at the 4-month section right here. Didn't we say before that surface antigen means what? Active infection. That's what it means. So if I follow this curvature, where does it go? Stops here. Huh. It stops before 2 months. Okay. So that means there's no active infection. Because if there was an active infection, wouldn't this curve continue to go like this? Well, yeah. Because at the 4 months, like the patient comes, sees you, comes back 4 months later, you take lab, and labs come back and they go, oh, I don't see a surface antigen anywhere. I see G antibody, anti-surface antibody, anti-E, and anti-G is actually really low. So I'm happy. I'm like, oh, this is kind of cool. Because didn't we say earlier that anti-H, this anti-B antibody, right? Surface antibody, what does that mean? It means the person was sick and now recovered or vaccinated. Okay, but Mr. Smith, I know him for the past 4 months. I know that 4 months ago, he came in sick. And you see, around the 2-month mark, it goes away. So there's no active infection. It's no active infection whatsoever. There is no surface antigens. To make it easy for you all, because this is a tricky question, look at the markers. At 4 months here, there is no surface antigen. You see anything here? No, it disappeared. It stopped at less than 2 months. The person resolved starting this way. So active infection, yes, yes, yes.